my last daily press conference for you guys in relation to the tragedy at the Gabriel House on Sunday night. I want to thank each and every one of you in the media here for your patience and understanding, and for recognizing the tremendous loss suffered by the city and especially the families of the victims of the fire. As soon as we have any meaningful developments moving forward with the investigation, we'll share them with you via press release or schedule a press conference if appropriate. The updates for today is I found out this morning that one of the critical patients at Rhode Island Hospital unfortunately succumbed to their injuries, raising the death toll of this tragedy to 10. Our hearts go out to them, their families at this time of extreme grief. We still remain with 2 victims at Charlton Memorial Hospital, 2 victims at St. Anne's Hospital, and 1 in critical condition at Rhode Island Hospital. As you may be aware, local and state investigators returned to the scene yesterday for a follow-up examination of the scene. And as we've been saying, this remains a very active investigation. Before I take any questions, I want to recognize a few people that I've been remiss since Sunday. The Fire Investigation Unit for the Fall River Fire Department and the Fire Prevention Bureau have done yeoman's work this week, above and beyond what their daily duties are, to assist with the state and to run the investigation and to get information for you guys that it's been on me why it hadn't been released till about an hour ago. I want to thank the EMA Director, Rick Aguiar, and his commander, Jeff Caron. The amount of time they volunteered this week at the fire scene, at the Tomeo Center, and on their own time really shows the content of their character. And perhaps the one that I feel most badly about not recognizing is the dispatchers and call takers. I started listening to the 911 calls and some of the radio calls from Sunday night, and for the sheer volume, the dispatch center is hectic on a day-to-day basis. They always do a fantastic job, but Sunday night asked them to do something well beyond their normal capabilities, and they performed remarkably. So I thank them for everything they did on Sunday night. If you didn't receive the email from the city, the fire department inspection records dating back to 2019 for Gabriel House have been posted on the city website. They're on the same place as the building departments were posted yesterday. So if you go to the city website, you go to the How Do I tab, you go to the Request tab, the Public Records tab, and then click on Public Records Archive. They'll be listed in there with the ones that were posted yesterday from the building department. And with that, willing to take some questions.
When it comes to these inspection records, they have dates of fire drills on them, but we've spoken to many residents, one just about an hour ago, who said in the 8 years he lived there, there was 1, maybe 2 fire drills done maximum in 8 years, but that's not what the records show. What kind of proof do you get of those fire drills before noting them in the inspections?
So I can't speak to the proof at the Gabriel House specifically, but when I did these inspections at nursing homes for 10 years of my career, they would maintain a logbook, and with a signature from whoever was responsible for conducting those, and that was the proof that we got from that.
So it's just someone at the facility, and you're taking their word for it?
Absolutely. Yeah, essentially, I think I mentioned this earlier in the week. I think that our role in these inspections is to ensure that the facility is compliant with the licensed sprinkler professionals, the licensed fire alarm professionals, and to do a walkthrough of the facility to make sure there are no safety hazards that we can see. And while we're there, we'll check the sprinkler systems to make sure they're on, that they're pressurized. But other than that, it's not a we need to rely on the licensed professionals to do their inspections, and we're just following up to make sure those are done.
Can you speak to, just as somebody who has done these inspections before, how it feels as fire chief to hear that residents are saying there weren't fire drills, yet the inspections are saying there were?
Yeah, I would have to look into that and see. Certainly, I would have to look into what their inspections and what their fire drills entailed. The nursing homes that we did, the fire drills aren't for residents, right? Because they're not going to be able to help themselves. The fire drills in the nursing homes we had were for the staff. In hospitals, the fire drills are for the staff. They're not evacuating a hospital. The patients don't know that there are fire drills happening, right? So I'm not surprised in this case that some of the residents weren't aware of it. So the staff is aware of what their responsibilities are in the event of a fire. It's not for the patients or the residents. Yeah, no, I anticipate changes in a lot of the way that these buildings are handled and these facilities are handled, including group homes and all the way through the gamut based on this tragedy. I mean, we've seen it everywhere in this country in the history of fire protection, from Coconut Grove to the Station nightclub. When there's a tragedy of this magnitude, things change. Unfortunately, that's what it takes sometimes to move the needle on legislation and codes, but you're gonna see that. That's gonna be a result of this. So let's see. I talked with Jake Wark this morning, and he just wants everyone to know that as soon as that becomes available, he'll be releasing that. So I haven't been in there to look at it, and talking to my guys yesterday, they were under the impression that they were easily removed. Now, easily removed by a firefighter is very different than easily removed by somebody who has mobility issues.
How often are those inspections being done? How often are the inspections done?
That facility required annual inspections from our fire prevention division.
How was your first shift? Maybe now it's your second shift with increased staffing?
So 5:30 last night we increased the staffing. I haven't heard anything. I don't know that we haven't had any incidents to be able to tell you, but I can tell you that I've had incidents. I had a fire shortly before I became the chief. I don't know if I've spoken about it already, so forgive me if I have. On Lion Street in Fall River, it was a nor'easter, and the chief at the time had upped manpower across the board to 4 on every apparatus. There was 60-mile-an-hour winds, and I pulled up to 5 structures on fire, including a garage and 2 garages and 3 houses. And because we had that level of staffing in the city, the only structure that was permanently destroyed was a garage, and we were able to save with very little damage 2 of the houses. One of the houses sustained some exterior damage, but what you can do in the initial 5 minutes of a fire with that manpower can make big changes.
In terms of the hiring, you said yesterday you'll be able to hire 4 new firefighters.
Yeah, so I haven't even had a chance to speak with the city on that. Right now, our game plan is to survive the next month or so until everything's ironed out using strictly overtimes. We have 5 recruits starting in October. I think maybe that's what you're thinking, that we're already in the hiring process. Before this, we have our SAFER grant application, and I'm looking into seeing what number we need to hire if we can get people quicker, sooner, to relieve some of the stress on the firefighters and the overtime budget.
Well, my question was more about, I assume these are all civil service. Will that delay the process? How will that sort of play into the whole thing?
Yes and no. So there's a new option in civil service called the local register, where the chief can create his own list of eligible candidates. If I can use that and have people who are already firefighter 1 and 2 and EMT certified, they could go through a very brief training through our training class and really cut down on that process. That's something I discussed with the mayor yesterday, and we'll be looking into if that's something that we can do in the near future.
Is there any sort of estimate when you might be up to that full complement that you think you'll be able to do now? Is it another year? Is it another 6 months?
It's going to be at least a year. It'll be at least a year for us to get up to that number, just in timing and just in hiring and getting people in.
Do you think you'll have trouble finding people who want to become firefighters?
We never do in the city of Fall River.
So in a lot of communities, to be a firefighter, you have to be a paramedic. In the city of Fall River, we train you. We'll hire you right off the street, train you to EMT, and train you to firefighter. So our civil service list is usually pretty robust. We don't usually have to go looking. I have not. I wasn't aware that that was released. I'm very much looking forward to seeing that.
Why are you looking forward to it?
From what I've discussed with the deputy chief of police, that it's really like a compelling footage, and it's going to really start to tell the story. As difficult as yesterday was, talking with my firefighters about some of the rescues they made, it's good to be able to see that and really start to piece the fire together. It's been an emotional couple days, as you saw yesterday, and I know I had a few requests and a few questions like what those emotions were, and I've gone through all the emotions this week. I think yesterday was just pride. I've been proud to be the fire chief in Fall River since I was hired, but I've never been as proud as I was talking to those guys and hearing those stories and seeing the sacrifices they made. And I think that's where that emotion came from yesterday, was just that incredible pride for what those guys accomplished.
You can see in that body camera footage.
Aspects of everything.
I'm sorry, can you start again?
Talk about the mental health aspect.
Yes.
Of how they're recovering after Sunday night. Do you feel like this could change the department's way of handling that moving forward?
Well, I would say that changed when I was hired as fire chief, and I'm not doing this, but I'm really been an advocate for mental health since I started. I really think the tide was already turning, with guys being able to start to process things and being more willing to talk about every call, not just this call. But yeah, I think this will turn the tide because of the number of firefighters who have been affected by this. We've already started to see some firefighters that I didn't think were going to be able to talk that are opening up. So yeah, I hope so. I hope so. What I told them yesterday was the average firefighter lives 7 years after retirement. The stress that you allow to go deep and bury in is one of the controlling factors in that, because it leads to drinking, it leads to stress, which leads to heart problems. So I encourage them to just keep talking. Don't let it get to that place. Talk about it with anybody who's willing to listen. Keep it fresh and keep it from really sinking in. So
You can see in the body camera footage from police that 40 minutes into responding, there were police officers still finding people in their rooms and taking them out. Have you ever had a fire like that before, where you have police officers going that far into things to help rescue?
There hasn't been a fire of this magnitude in 40 years in the state of Massachusetts. So I certainly have never seen anything like that. And I credit those police officers. I spoke to them the night of the fire and said that was absolutely amazing what I watched them do. That's not their job. That's not their comfort zone. So for them to be able to recognize that, to go in, to take the smoke that they did, and to save people, that was absolutely amazing.
Does it make you rethink just how mutual aid in the city will work if other departments should be going straight to the scene?
Yeah, yes and no. I mean, we had this discussion yesterday, and it's something we're definitely going to kick around. It's sometimes too many people on a scene like that don't work together. I think if we were going to go that route, then we need to do a lot more training with our mutual aid partners, which is certainly something we'll look into. I wouldn't be surprised if that's not in the plans already with my fire prevention division. Once they can have a deep breath and exhale and really, get their feet back under them from what they're still continuing to do with this scene and with this call, I think it would be prudent to get out there and really see what we're up against in these facilities. One more? That is not my department. I would refer that one to the building department. But it would be a long time before that happens, because there's going to be a lot of investigation and insurance stuff that determines that as well. So Glenn Hathaway, the buildings inspector, would be the proper person to ask that question. Thank you, everybody. It's been a pleasure, really.
Thank you.